now say that you shouldn't drink more than 2 drinks a week, or it presents a risk of cancer and other diseases. What do you think of that?
I believe more than 2 cups okay.
So you don't believe the guidelines then?
Not really.
I think these studies change over time, and it seems like there's a different study out every couple of years.
2 drinks a week? Is that a week? I'd rather go for about 5.
Well, will the guidelines affect how you drink?
No.
Do you drink more than 2 drinks a week, do you think?
Probably, yeah.
I think we've got a very pro-alcohol culture.
Do you drink more than 2 drinks a week, do you think?
Is this what I tell my wife, or is this what I tell you?
Well, mixed opinions there on new guidance out this week on drinking alcohol. Experts recommending no more than 2 drinks a week, drastically down from the old recommended weekly limit of 15 drinks for men and 10 drinks for women. This move is in response to evolving data on the risks of cancer and heart disease linked to alcohol. But a limit of 2 drinks per week, really? Is that necessary? Well, let's ask a couple of experts. Dr. Fawaad Iqbal is a radiation oncologist at Durham Regional Cancer Centre. He's in Markham, Ontario, not far from Toronto. And Dr. Tim Naimi is the director of the Canadian Institute for Substance Abuse Research at the University of Victoria. Welcome to both of you.
Thanks for having me.
So, Dr. Naimi, what is the guidance for Canadians?
Well, the overview of the guidance, Ian, is that when it comes to health, that less is better. Less alcohol means a bit longer life. Either no consumption or up to 2 drinks a week is considered low risk. And then up to 6 drinks a week is considered intermediate risk in the new guidance. And above that is considered higher risk. That said, we understand that a lot of people won't be able to or wanting to cut down to that degree. So we really want to talk to all drinkers, and in some ways, especially people drinking at even higher levels, that they can really help their health by cutting down on their consumption. So we're trying to talk to everyone.
There are so many variables here, of course, Dr. Naimi, but let me ask you this question as a follow-up. For those people out there, I'm sure many of whom are watching right now, who have, let's say, a glass of wine with supper every night. So that's 7 drinks a week. You know, you talked about moderate risk, but what does that mean? What kind of risk are they facing due to those, on average, 7 drinks a week?
Sure. For around 7 drinks a week, just to give you a sense of it, you're coming to close to about a 1 in 100 chance of an alcohol-caused death. So it depends how you value that risk. You know, it's sort of maybe getting up there a bit. So you can cut it down by reducing it. But again, we're not just interested in people getting to one number, just this general idea, again, that less is better for your health overall.
Dr. Iqbal, you're an oncologist. You deal with people who have cancers all the time. What would you say to people who feel a 2 drink a week minimum or maximum is too low?
I mean, it's really about decision making. Everybody has their priorities, right? I mean, maybe you choose to eat a whole lot of pizza, you know. I mean, there's all sorts of decisions about how you exercise, you know, what you choose to do with your time. Alcohol is certainly an identified carcinogen. So, I mean, for me, on the tail end of all of this conversation, it's tough to have that conversation where people in retrospect were like, oh man, if I knew there was cancer from my drinking, I wouldn't have had so much.
And so as an oncologist, like, you must have versions of that conversation all the time, certainly with smoking. And so tell me a little bit about that. I don't know, is it remorse? Is it defiance? How do people feel when they have cancer and they're thinking, boy, you know, I think I know what the risk factors were here?
Yeah, so you just mentioned lung cancer. And I mean, I've been at this for almost 20 years now in terms of my cancer part of my career. I've never, ever met somebody who smoked and got lung cancer and was shocked to be talking to me. Because that information has been around for decades, right? That, you know, smoking can cause lung cancer. But when I have the conversation with a colon cancer patient or a breast cancer patient, most of the time, by far the majority of the time, they're absolutely floored that, oh my God, what do you mean that's a risk factor for cancer? And I mean, it certainly goes along with consumption levels and exposure over time. I think that's definitely a factor as well. But patients are more often than not just shocked. I would say that's their main reaction.
A lot of people have been talking about this new guidance all week, and we've been getting lots of questions here. So I'm going to put some of those to you, starting with this one to Dr. Iqbal, if you don't mind. Mick Roon asking, what causes the cancer risks? Is it the alcohol or is it other chemicals in the alcohol?
Yeah, unfortunately, it's the alcohol itself. So there's not really a distinction between the type of alcohol that you're drinking. So going back to perhaps some older evidence where people thought, oh, if I have a glass of wine, it might be protecting me. So that's not true, number one. But whether it's wine or beer or spirits or whichever, it's actually about the content of alcohol. Because alcohol, as it works its way through your body, is directly responsible for damaging your DNA.
All right, and this next question touches on that, Dr. Naimi. Vicky Rosedale asks, does it matter what type of alcohol is consumed? Well, we've just heard the answer to that is no. But how about the second part of her question? Are there higher risks with spirits as opposed to wine?
Yeah, that's a great question, and a lot of people ask it. So the idea here is that it's the amount of ethanol, that's the active ingredient that gets consumed that Dr. Iqbal was referring to. There's about the same amount of ethanol in a standard size can of beer as in a glass of wine, as in a shot or 1.5 ounces of spirits. So it's the total amount of ethanol that one consumes that's the major determinant of risk. Part of the guidance that we're really calling on is for the government to institute mandatory labeling on all alcohol products that, for starters, would include information about the number of standard drinks in each and every container and the volume of liquid that would constitute a drink. This is basic because if we're going to have guidelines that are helping people to try to understand how much they drink and possibly to cut back, they need to know how much is in the bottle. And to go with that, we also need information on health warnings like cancer. We have these for cigarettes and for cannabis in Canada. So alcohol is a glaring exception. I'm actually from the States, and it's a pretty free market place, but there's even been alcohol warning labels in the US for 40 years. So I think it's time to up our game in terms of information sharing with the public.
We have about a minute left, 30 seconds to each of you to answer this last question. And Dr. Iqbal, I'll start with you. It is Friday night. You know, maybe some people are having a glass of wine as they watch the National and looking forward to the weekend. What do you say to people who, you know, are used to having 4 or 5 or 6 drinks spread out over the weekend?
Less is better. I mean, that really is the bottom line messaging that we're going for. You know, reaching 0 for a lot of people would be unrealistic. If you can do it, that's great. If you can't, just try and cut back as best as you can. It'll pay off in the short term with a lot of health benefits in terms of, for example, weight loss. But over time, you would decrease your risk of many, many really bad outcomes, including cancer.
Dr. Naimi, I'm sure you agree with everything Dr. Iqbal said, but let me add this to the equation. At this point in the pandemic, I mean, we went through so many restrictions, so many rules. People are just starting to socialize, you know, now, and that involves alcohol. Again, on the Friday night before the weekend, what do you say to those who are thinking about alcohol-related events coming up?
Well, sure. We're not telling people that they shouldn't drink. Again, the message is to cut back. What I've been telling for my friends, you know, who really enjoy their alcohol, the objective of cutting back, they can think of it as that they'll live longer to enjoy, you know, their alcohol well into their 80s and 90s and beyond. So I think it's hope they'll consider it.
All right. Well, I appreciate both of you taking your time on this evening to help explain this. Thank you.
Thanks for having me.
Thank you.